Dr. Shalom Qazi is with Mon Health and Vandalia Health in West Virginia. He joins us on Metro News Talkline. Dr. Qazi, good morning. Thanks for joining us. What do these numbers really mean in terms of West Virginians' health, the patients you see? Put a face on this, doctor.
Sure. Thank you for having me, Hoppy. I
Yeah.
really appreciate the chance to speak to this really important issue for the state. Being born and raised here in southern West Virginia, I'm from Nitro originally, born and raised in Charleston. We know that smoking is a communal, kind of activity. People don't smoke in isolation. They're smoking with their friends and their families, their coworkers. There was never a job growing up as a teenager that, like pretty much everyone took smoking breaks. The issue I think West Virginia has is it's not just individual smokers. It's really people smoking as an activity together, and that's kind of when I'm approaching my patients. I always we have to really take a step back and not judge them for smoking. Of course, everyone knows now the risk of smoking.
Right.
But back then, a lot of people started smoking, and again, it's a cycle that perpetuates generation to generation. That risk was not very as clear and definitely hidden by tobacco companies.
So how do you break the cycle? Like you said, if it's communal, it's like a lot of things. You're with other people, they're smoking, or it's the same way with drinking. How do you break the cycle?
I don't. There's several ways of doing that. Obviously, from a physician standpoint, we talk about in our clinics. We don't. I mean, when I see patients who are still smoking, they got a lung cancer diagnosis. Those people want help. They do not want to continue smoking, and we got to give them help and cessation tools. But I usually try to say, okay, well, who do you smoke with? Who's there smoking with you? And if they're there in the room with them, I offer them even cessation aids. On a level of as a physician and with a patient, we have to try to move that needle that way. I'll say this, as a society, we really need to prioritize this. Back in 2005, we had that huge West Virginia Tobacco Settlement Trust Fund, got $232 million allocated to us, and unfortunately, and I don't want to get political here, but it's just the legislature has been taking that money in annual installments and not really allocating it to the best uses for tobacco cessation.
So you're saying you say we don't do enough for smoking or tobacco use cessation?
I believe that is definitely one of the biggest, detriments to getting people to stop. Because, I remember when I was in training, we had a lot more robust services for quitting. Now, right now, and anyone listening, if you're really interested in quitting, we had the West Virginia Tobacco Quit line at 1-800-QUIT-NOW. They've been available, for all this time, and they provide, cessation aids. But they were better funded, back then. They were getting I think $7 million a year was what they were getting budgeted from the legislature, and that went down to now only $455,000. So it limits the amount of aid that people can get.
Doctor, here's what I think is one of the problems is that most people who smoke, and I'm going to make some generalizations here, but I think they're true. Most people that smoke started when they were young, and when you're young, you're going to live forever.
Yes.
And then when you think about quitting, you can quit, and still 10 years, 15 years later, you talk to people who've quit, and they say I still wish I had a cigarette. I mean, and that to me, that's overwhelming. That's hard. So I have empathy for people who are trying to quit.
That's why, we really have to be non-judgmental with these people, because realistically, nicotine is the most addictive substance we know. I'm telling you, I have people crying in my clinic telling me, listen, I know it's bad for me, but I can't quit. And they're coming to me with stage 4 lung cancer, and it's just so disheartening to see the hold that tobacco has on some of these people. And we try our best to get them, because even at the point that they have lung cancer, we know that they will live longer if they quit smoking, even at that point.
Is it true? Is it true that even if you smoke all your life, when you stop, that your lungs begin to heal, or is that a myth?
There is truth to that. There is definitely truth to that. There is immediate kind of physiological processes that restart in the lung as soon as you stop smoking. If you stop smoking long enough, I mean, let's say you stop for 15 years, your risk almost comes back to normal for developing lung cancer.
Really?
One of the things that we also see here, and this goes to the actual the numbers you just quoted about lung cancer, is that we underutilize lung cancer screening here in West Virginia. Unfortunately, again, a lot of people don't take advantage of these programs for low-dose CT scans that are offered by Mon Health and WVU and all these.
So early intervention. You say we need more early intervention.
Yeah, because one thing that report did show is that we've had an increase in longevity when people have lung cancer. I mean, that we have better drugs. I have people who are 4 or 5 years out on stage 4 lung cancer because we have better drugs. That's not we do have those things out there, but those are costly and expensive, and they don't always work.
And doctor, I tell you another thing is that it's not just lung cancer. I mean, anecdotally, my father died of COPD. My father-in-law died of COPD. My mother-in-law had trouble breathing. My people I work. I mean, to get to a point in life like, I don't have cancer. Yeah, but you can't breathe and you're on oxygen.
Right.
It's brutal.
Definitely, the comorbidities that along with lung cancer. I mean, we have a coal miner population that has black lung, and I'll tell you, I think we're seeing more of that now than we did 20 years ago. We have a lot of drilling operations around here. There's a lot of exposure, environmental and occupational exposures to different hazards that also increase our risk of cancer.
Doctor, tell me this: smokers today, smokers listening to this program, or people that quit, start, maybe they're going to quit again. Give them a hope. Give them give them something to hang on to right now.
I'll tell you, what you just said about quitting and restarting. It takes the average amount of times it takes to actually quit smoking is about 3.5 times. I tell all my patients, I don't care if you quit for 1 day or 2 days or a month. Keep trying to quit. If you do it enough, you will eventually quit. If you show that initiative to do it, you will do it. Just get some help, though. Please do not do it on your own. I mean, there are some people who have strong, wills who can definitely, quit on their own. But get help. There is help out there. I wish there was a little more help out there, but definitely get the help that you can and stop smoking.
All right, Dr. Ihtishaam Qazi with Mon Health and also Vandalia Health System on the smoking cancer figures.